everyone, and welcome to today's session. My name is Dr. Lowell Kabnick, and I'm the chairperson of Vein and Lymphatic University. VLU is a premier educational platform whose mission is to deliver groundbreaking, high quality content utilizing the talents of a diverse global team of health experts focusing on venous and lymphatic disease and treatment for the medical community and its patients. The goal of VLU is to make a positive impact on the global medical community by accelerating venous and lymphatic education through highly accessible and interactive live webinars and lectures, informative videos, and other premium channels of community engagement with the aim of empowering, inspiring, and advancing understanding of venous and lymphatic disease and treatment. Our initial series is titled EmPowHER, which was developed by Ruth Bush, Sarah Onida, and Leanne Alizio. This is a series of webinars crafted and directed by our women colleagues for all. On behalf of VLU's Executive Board, we thank you for joining us. Hello, everyone.
Hello, everyone, and welcome to today's session. My name is Victor Canata. I'm the president of Vein and Lymphatic University. VLU is a premier educational platform whose mission is to deliver groundbreaking educational content with a diverse and talented global team of health experts in venous and lymphatic disease for the medical community and his patients. Our goal is to have a positive impact, accelerating venous and lymphatic education through interactive live webinar, lectures, video, live podcasts, with community engagement like social media, and empowering the understanding of venous and lymphatic disease and its treatment. That goes on behalf of VLU Executive Board. We thank you for joining us and we wish you an excellent webinar. Have a good one and thank you very much.
All right, well, welcome everyone. My name is Ruth Bush, and I'd like to greet everyone and welcome you to Vein and Lymphatic University's inaugural Women's EmPowHER series. We're kicking off the series with a roundtable discussion with some women physician and business leaders. And I'd like to welcome all of you for participating and to our attendees on behalf of myself and my co-moderator, Dr. Sarah Onida. I'd like to thank Dr. Victor Canata and Dr. Lowell Kabnick for creating and envisioning this international forum. I also thank Leanne Alizio, who has been the organizer, the developer, and has kept us all really moving forward in this process. VLU will be offering monthly webinars, which Dr. Onida will be describing. Many of you are invited already as experts. If others are interested, please don't hesitate to email us to get involved. Some of the core values to all of us are diversity, equity, and inclusion. And to start off VLU 2021, we're holding this informal roundtable discussion with women leaders, as I said, both physician and business leaders. We hope to learn from each other, have some frank discussions, and know that this is a safe space for discussion. If you have questions, put them in the question and answer portion or question and answer portal, not in the chat. So use the Q&A. And I'll turn it over to Dr. Onida.
Thank you very much, Dr. Bush. So I echo sort of the thanks to Dr. Kabnick, Dr. Canata, and to Leanne Alizio for the involvement in this great initiative over the next few months. So as Dr. Bush mentioned, this will be in the form of monthly webinars. The first Saturday of every month, 75 minutes in length, and they'll be discussing a range of topics in phlebology and venous disease. We'll revisit this later, but the next one will be on the 3rd of July, and the first example will be superficial venous insufficiency. And the way these are set up is mainly to have expert leaders in the field of venous disease and to have informal discussions with respect to case presentations, for example. We'll have involvement of live cases, but to make it less didactic and more interactive, and a discussion as to what experts in the field at the moment are doing for different types of cases. And I'm sure there'll be very interesting discussions depending on where people work and how they approach things. So this will go on, as I said, every month for a range of different topics, and absolutely we're very much keen to make this interactive. So any questions anyone may have, just put them in the Q&A and we'll be able to address them whilst we perform our webinars. So next, I think will probably be introductions, and I'll kick off. So my name is Chiara Onida. I'm an assistant professor at Imperial College and a vascular surgery resident in London in the UK, and I've very much at the beginning of my research career and very excited to be involved in this fantastic initiative that I'm sure will be very educational for me, you know, having such fantastic leaders with us here today to be able to tell us about their experiences. Next, Dr. Bush, if you would like to introduce yourself.
Sure. Ruth Bush. I'm located in Houston, Texas. I am a professor of surgery. I do practice mainly venous disease at a veteran hospital. I'm also an associate dean at the University of Houston College of Medicine. And I think I'm probably considered, Kathleen, help me here, senior, so at the other end of the spectrum.
Great, thank you. And then just to make things easier in the context of a webinar, perhaps I will go around everyone just to make sure everybody can introduce themselves. So actually, shall we move to Kathleen Ozsvath next?
So I'm 29 years old, just like Ruth. I am chief of surgery at a hospital in upstate New York. I'm also a professor of surgery at Albany Medical College. And I'm a vascular surgeon, and I still do arterial work as well as venous work. And I've been in practice for, gosh, it seems like 20 plus years now.
Thank you. And then just moving down my list, actually. So next I've got Susan Smith.
Hi, my name is Susan Smith, and I'm the manager of medical education and medical affairs for Boston Scientific. Boston Scientific is honored to support this initiative. Very excited to be part of this first one. I live in the Atlanta suburbs and have been in this position for about 5 years now. Previously with Boston Scientific for 13, so a long history. I'm probably the person that I know most on this call is Ruth Bush, because I've known her since she was a fellow at Emory.
Thank you, fantastic. Next, Kat Jennings.
Hi, thank you so much. So my name is Kat Jennings, and I'm the Vice President of Marketing and the General Manager for Verathena. And I've been in the med tech space for almost 20 years. I'm really excited for this conversation.
Thank you. Chiara Lomazzi.
I'm Chiara Lomazzi. I'm from Italy. I'm a vascular surgeon, and actually I'm a contract professor at the University of Milan for residence and fellowship training program in vascular surgeon. And I'm practice endovascular procedure in vein topic and other aortic and peripheral at Policlinico di Milano.
Thank you. Next, I've got Claire Donnelly.
Hi, everyone. Thanks. It's an honor to join you all, and thanks to VLU. So I'm Claire Donnelly. I am Australian, but I'm based in Glasgow. And my background is I've worked in various leadership roles within medtech, and currently I'm in a digital health startup where I'm the head of commercial.
Fantastic, thank you. And last but certainly not least, Paola Ortiz.
Hello and good afternoon, and thank you very much for the invitation. It's an honor, and thank you for the opportunity. Paola from Uruguay, and I am a doctor. I'm the director of Uruguay Vein Center, and this center is a branch from the United States, Naples Cardiac Endovascular, and I'm happy to offer in my country different endovenous techniques. And thank you very much.
Thank you. I think that's probably it for the introductions. Dr. Bush, shall we get started with the Q&A then?
Sure. So I'm going to start with a question, and I'm going to ask Paola and Kathleen to start out by answering. By no means this limit is limited to the two of them, but I got to call on somebody to get started. So my first question is, I think people want to hear, what's it like to be a woman in your shoes? What's it like to be a woman leader at your institution? Do you have to behave differently? Did you have to do anything differently to get to where you are? And I will ask this of Paola and Kathleen. Paola.
Okay, so thank you very much, Dr. Bush. Well, for me, everything began many years ago. I'm challenged myself moving to the United States to further my career. And so I faced there different culture and language, but I overcome all these difference or different style of life, also because I had to work at the same time I was studying. And I overcome everything with dedication, enthusiasm, and passion for what I was doing, and also study and working at the same time. And moving back home, it was also a challenge because here phlebology is new, it's a new field. So I had to create my own space at the private place. So I create my vein center. So now the vein center have more than 5 years, and we have a lot of patients, and we are in contact with my vein center, my mother. It is in Naples, Cardiac and Endovascular Center in Florida. And at hospital, also I had to create my space. So I offer my services to the directors, and they gave me the opportunity. So now I have a good position at the hospital, and I'm working with different doctors in a multidisciplinary teams. And I'm happy with this, but of course it's challenging, and it's a step by step process. But I'm happy with the results, and I'm still working on, in the process to have better impact around.
Thank you. Kathleen.
So I feel just like Ruth is in Texas now. I grew up in Texas, and I went to medical school in Dallas. And at the time I went to medical school, there were a lot of professors that told me I could never do surgery because I'm a girl. And I smiled, and I then got a residency spot in New York City, figuring that New York was way ahead of Texas when it came to how they treated men and women. And I never looked back. And I have to say that overall, my experience training in New York City and then moving to upstate New York has been really, really positive. And I always felt that I had incredible mentors, Dr. Kabnick being one of them. He was my attending surgeon when I was a resident. And I really had a great time training in New York. It was great. When I first started out in upstate New York, I did have challenges when I tried to open the first vein center in our area. It was my partners that actually kind of gave me a hard time, but I think I proved that it was going to work, and it did work ultimately. And then I gained support by showing that I could make something happen. And what I found over the course of the years, that just working really hard and just sort of in a nice way, not in a barreling way, but in a nice way, try to show that my ideas were actually going to be helpful, and to use data to support that went a long way. And I was offered chief of surgery a few years ago at my hospital, not because I went knocking and asking for it, but because I think that, the things that I set out to do, I did. And I think people chose me because I was the right person for the job, not because I was the right girl for the job or the right, you know what I mean? So it's kind of, it's been an interesting evolution. but I'm looking back at it. I feel like I've been supported all along by those people that I work with.
Thank you. I appreciate your insight. I'd love to hear from some of our business women. You know, I've worked with Susan Smith for, as she stated, since I was a fellow, and you had been doing industry for a long time before that, Susan. So you've seen things over the evolution of having female representation, which I suspect was very little in the 90s. Love to have you comment.
Thank you, Ruth. Makes me sound really old, so I might as well admit that I am really old since I had many years before I met her. But my first job out of school, I'm a registered dietitian. So that was traditionally a woman's role. And I was in that position for probably about 2 years before I realized that I wanted to do something else with my life. And I was very fortunate that doors opened for me. And having the nutrition background, I went to work for Ross Labs. And then from there, I was also kind of following my husband as he was getting transferred with his job, got into medical sales. I said I was with Boston Scientific for 5 years. Now in medical affairs, I was with Boston Scientific for 13 years prior, doing medical education. And I've probably met some of you when we were doing training courses for vascular surgeons and how to do endovascular procedures. So, but I never thought that. I always felt like I worked hard, but I never felt like I had to prove myself. And just like Kathleen, I love what I do. I'm passionate about it. And if you like what I do, great. And, you know, if it's not working out, then, you know, I have the confidence to do something else or something like that. But the first time that my eyes were opened to all this was when Ruth was a fellow, and she bought herself business cards because she said nobody called her Dr. Bush because she was a woman. And I thought that's really tough. And I don't even think Emory paid. I think you went out and bought your own, right?
Correct.
And I thought,
yeah.
this is something that I never thought about, of course, but at that point, most of us only saw men doctors and things like that. But that really made an impact on me. And and that has helped me in my career. And I've also mentored people through a local organization and through my church, teenage girls, to give them confidence to make their dreams come true.
That's awesome.
Kat, I know you've had a very interesting journey also.
Yeah, I mean, Susan, I would echo a lot of what you said. I feel like I've been so lucky because there are women that have come before me that have paved and a lot of paths forward. And it is, I think, similar to what you said, right? Oftentimes people assume you're more junior than you are in any room that you enter. At least that's been my experience. I know that in speaking with other physicians, right, that the challenge of not being assumed to be, either a nurse or a PA, some of those types of challenges. And, I think that, my job is to make it better for the women that come after me. So can it be an easier path for the folks that come after me to be able to rise either within this organization or other organizations?
So I have one comment to make about that, and I'm just going to ask Kat. Kat's probably what, 5'1", maybe?
With heels on? Yeah.
With heels on. And she is a little dynamo. And it's just, sometimes, height and presence. My husband's 6'4", so he walks in a room and you believe whatever he says, no matter whether it's the truth or not. But for, I think for short women, that sometimes, that might be a little bit of a hurdle. Obviously, it has not stopped Kat or anybody else, but I just thought, good for, people that are, they look at more than your height, your face and your gender.
Well, I think, it's funny. Yeah, I think it's part of things that you can take advantage of, right? It's like Kathleen said, right? There are some things that you have that are real advantages because people don't, they're more open, right, to ideas that you might have if you're not as imposing. And so I think sometimes that's worked to my advantage.
There you go.
That's
So
awesome.
look for the positive.
That's right.
One comment I would make is that what I found in my male counterparts was that the loudest guy got heard. And I always found that that's an annoying way. I think it's an annoying way to communicate. I always found that the way I got heard the best was that if I could back up what I was saying with something, with solid, with data, with why, I didn't, with non-emotional information. And that's what got me heard when I felt like I needed to be heard. God, I love it when people think I'm young or younger than I am now. But I know when I was younger, it really annoyed me when I'd walk into a room and people thought, that I wasn't who I was. But now I laugh. I think it's great. If you think, it does, I'm confident in what I'm doing. So it doesn't bother me the way maybe it used to when I first started out. And, again, one of the things that I found has really been helpful to me from a mental standpoint is that I've realized that I'm a really good mom. And one of the things that draws me into into medicine, and what drew me was I want to take care of people. And I can use that experience as a mom to be a good doctor, or to be a good mentor, or to be, help my staff in how to do things. And I feel that gives me an advantage in a way over some of my male counterparts.
That's awesome. Thank you. Thank you all. I will just give a couple of 2 cents, but because I think that many of us have experienced things. Some of it's been great. Some of it we've had to develop some thick skin over time and stop listening to the background voices and listening to what I would call the noise. Susan mentioned at Emory when I was a fellow that I printed my own cards because my co-fellow, the senior fellow, there was only one of us per year, he would be introduced as Dr. So-and-so, and I would be introduced as Ruth. This was how the fellows were introduced. But also at Emory, and I by no means have any different stories than the women who were very brave and came before me, is that Susan will remember at Emory, even the doctor's lounge. The doctor's lounge at Emory was part of the male locker room at that time. And so we had the staff lounges and then the doctor's lounge, and that was in the male locker room. And I, being the only female fellow there, that's where the business takes place. That's where you get cases. That's where you talk about research projects. That's where you find out about opportunities, the locker room meetings, if you will, because us as women would have been the only people in our locker room, which was the staff locker room. There was a women's locker room, the male locker room, and the doctors. And so I just, said the hell with it. I'm a fellow here too. I'm going in the male lounge. And Susan, I don't know if you remember, but they had to start shutting the door to where the men changed because I didn't care. I was just, I needed to be at the table. We need to be at the table. And so that's one thing I teach my mentees is when they go in a room, whether it's a committee meeting or something, sit at the front, sit around the table. Don't sit in the back row. Don't sit in the back wall. You belong at the table. And the only way we're going to get there is to keep showing up and to keep showing up. And, now with Kathleen, yes, Kathleen, we are mid to senior. It's easier. It's much easier. It's not as intimidating. Yes, ladies, by no means. It is still intimidating. It is still intimidating. Just don't show it. Just don't show it. I'll let Sarah
I'll just make,
ask the next.
yeah, no, I'll just make a couple of comments because obviously I'm going towards the end of my residency and sort of the start of what comes next once you finish residency and you finish your training. And I think things are better. I've not had to do obviously some of the things that you've had to do to be heard and to be part of, be able to participate and get those opportunities. But I think you're absolutely right. It's still there. I will often, be mistaken for the medical student or for a PA or for a nurse, especially now with COVID and having to wear scrubs and everybody wears the same clothes. It's very easy, and that the patients obviously don't necessarily know any better, quite rightly. So I think that whole view that you'll have the male surgeon or the male physician is still there. But I think obviously there are, because people like yourselves have started this and paved the way, then it is easier for us coming through now to be able to develop as sort of physicians and researchers. But I think you're right, and I think it's in the hospital as well as in the academic circles as well. And if you look at the number of female trainees that are on a clinical academic pathway in vascular surgery, funded from National Institute for Health Research, there's maybe only 1, 2 there have been recently. Female professors, obviously there's not as many as there are male professors, and there's still a long way to go. But I think the opportunities are a little bit better now compared to sort of previous years. I just wanted to go back to the first questions about being a woman leader in an institution, and ask that of Dr. Bush, who's obviously has a huge wealth of experience and has had quite a journey. So I'm just interested in getting your insight in terms of how it's been being a leader for you in your institution now and mentoring your trainees who are coming through now.
It's been an evolution in my over time, and I think my interests have changed over time and what my priorities are and my focus. I now realize that one of the greatest things I do is mentor learners at all stages, whether it is students. I mentor some undergraduate students, vascular trainees, general surgery trainees. I have a dermatology trainee who has been a mentee for a while. He thought he wanted to do vascular surgery, and then something excited him about skin, and he changed fields, but I'm still his mentor. And I'm a mentor to men and women. I think that I was fortunate to have amazing mentors, and we can talk about that and how you find mentors at a young age. My mentors were men, but I never felt in medical school that I never felt like a female medical student. Even when I was in medical school, over 40% of the class was women way back, 30 years ago. Now in the United States, over 50% of incoming medical students are women. That is trickling up to, to residencies, and then, it'll take some years for us to see the differences in assistant and associate professorships. But I never felt that I didn't think gender it wasn't a thing when I was going through medical school. It became a thing when I got to residency. And I went to a very female-friendly residency program, UC Davis in Sacramento. My chief at medical school he and I had worked on where I would apply to residency based on who was female-friendly and who was not, because that was a consideration back then. But having female surgical residents was still new for folks. And that was the first time I realized, oh, my gender's an issue, because I hadn't realized it. More so in fellowship, because, you know, when you're only like the second woman who's ever come through a program, it's, you know, the tokenism I felt was real. And I did have a chip on my shoulder for a while about it. And, you know, microaggression was not a word. Mistreatment was not a word in the early 2000s. You felt like you had to go along to get along. And I had to be told you can't act like the men. That doesn't work. And so I had to figure out, oh, that's all I've known. That's all I've seen. And there's different expectations. But I also learned how to be part of a team, I think, quicker. And I think one thing that women do very well is be part of a team. I'm not a mom, but I've realized that, you know, the medical students are all my kids. The residents are all my kids. But I think that's one thing that we do better is sort of nurture, sort of corral all the younger people and even the mid-career people. They want to know, how did you do it? You know, we'll talk about balance in a little bit. They want to know how, you know, did you have this happen, that happen? Yeah, we all have war stories. You know, we can laugh about some of them. Some of them we need to learn from and try to, as you said, or someone said, pave the way. I think Kat said this, pave the way and make it better. It's already so much different, so much different. I mean, look at all these amazing faces here, and, you know, people we interact with. Some people are going to think that gender is a thing, and you know, they can just go away. I have learned I'm not going to convince them or change somebody's mind. So I don't try. I just move along.
Right.
Well, Ruth, sorry.
Oh, sorry, go ahead.
No, Ruth, I would say, and you are definitely somebody who is an incredible mentor, just by the way we carry ourselves and the way you carry yourself, and as well spoken as you are, and the fact that you're able to, you know, create an environment for people that's comfortable. I think that goes so far, and, you know, I'm sure that that's added to your success.
Oh, thank you. I think, you know, one of the words that I've really become engrossed with over the past actually several months is psychological safety and having a psychologically safe environment. And what does that mean? I've been reading this woman named Amy Edmondson, who's done all research in psychological safety. Great writer, great books, and how you create a psychologically safe environment so that people like all of you all can bring great ideas to the table, can bring diversity of background, experiences, opinions, and have those be heard, and create spaces so that they can be heard and that people don't feel humiliated or belittled by bringing ideas forth. And I think that's one thing that leaders, and I know that probably Kat, Susan, and Claire in their jobs in the business world, that's probably not new that those spaces have to be created. I think in medical schools, I think in hospitals, we're sort of a little bit further behind in, you know, who would think of an operating room when you were in training as a psychologically safe space? Oh my God, I was in fear. And we shouldn't have fear. We should not, you know, my students who are in there should not be afraid to ask a question. Now I might say, now's not a great time, let me focus, but I'll get to it. But they should not have that fear of speaking up, you know, or saying, you know, I need to step back, I feel faint, or I need to go to the restroom or something. They should not be in fear. So we've got to create those psychologically safe spaces that will innovate and push forward ideas. And I think that's one thing I will just give my hat to Dr. Kabnick and Dr. Kanata for envisioning this plan and creating a safe space for Sarah and I to think about what we want to do over the next year.
I think that's, those are all really sort of important and wise words from sort of significant experience that we can all learn from. I was just interested to hear from Chiara actually about what your experience has been, because obviously some of us are based in the US, some of us, we've got obviously Paola from Uruguay, I'm, based in the UK. I just wondered what Chiara's experience has been, in her own unit, as a sort of, resident and then becoming a leader in her own institution. What has it been like for you in your experience?
I think about what mentioned Ruth is that the younger generation have now the fortune to have more female colleagues. So I had in my resident experience and fellowship experience a lot of female colleagues. We were in 4 with 2 male at the head of the team. And so we feel more confident because we are more numerous, and we feel more comfortable to make questions and to try to have more experience with I have no female mentor. I have a man mentor, they never feel non-comfortable. So that was important. I think it's more easier for us in the younger generation compared with the experience of Ruth, of the other in Houston, where there was a lot of male in the team and so on. The world is very different. I mean,
thank you.
Yeah. And what about the? I know that something is really changed in the hospital, in the university world. So more female are approaching, and so can make very different the academic and the hospital team about this topic.
Thank you. I think you're right, and absolutely, it's I now have quite a number of sort of female colleagues at my level who are involved, obviously are vascular surgery residents and are involved in research and are, and we're all kind of at the same stage, which is really nice, because actually you're then able to, compare experiences and have a chat with, with your colleagues about that and how they're finding things. And all of them are sort of balancing lots of different things, and some of them are part-time and some of them are full-time but have a little one and support at home. So there's lots of different ways of going about it. But yes, I think you're absolutely right. It's much easier for us now than it would have been previously. I just wanted to go back to the mentorship topic, because actually that's a really important topic. And similarly to what some of you have said, I've had one female mentor. And then as part of residency, we have to change jobs or rotations, every year. And every year I've managed to find another mentor under whose sort of wing, I would be surgically. And obviously I've had an academic mentor who has been male for a long time. And same, I've never felt like my gender was ever an issue, and I was always treated the same way as everybody else. And as long as you worked hard and got the work done, no one asked any questions, and there was no difference in terms of what opportunities were given or not. But I've always been very fortunate to have had extremely supportive male mentors who've really championed all their female surgical or academic trainees in the department. My female mentor did, similar to what we've discussed, has also gone through all the difficulties that she's had in the past and trying to sort of prove herself in the 90s and the early 2000s. But I just wanted to know what your experiences of mentorship were, and now that you're, further down the line, how your mentorship style is and how you approach that. So perhaps Kathleen first.
So that mentorship, I think, is so incredibly important. And when I first went to New York as a resident, the person who became sort of my mentor and got me into this was Donna Mendez, who was the first African American woman to graduate from Columbia University Medical School and the first African American woman to be part of the SVS. So she and I was on the phone with her the other night. We still talk 30 years later or whatever years later it seems like. But she was an incredible mentor. There was another woman who was a cardiac surgeon who could operate like nobody's business, like in circles around her male counterparts. So those two women were extremely important to me as I was sort of trying to figure out what kind of surgeon I wanted to be as a resident. And then when I became a fellow, all of my mentors were obviously male, and they were great. And they were not just mentors in the hospital and teaching me vascular surgery, but they were also very involved as life mentors, if you will. So I agree. It's not so much the gender; it's how they react, how they associate with you as well. I think now what I try to do is I love to teach. So whether it's a nurse, whether it's a whoever it may be that I come across in my travels and in the operating room and so on, I think education is important. And again, getting back to what Ruth was saying, creating that environment in the OR, for example, that's a safe one where we can have a good time, but still be serious and ask questions, answer questions, whatever that it may be.
And what about from a business sort of perspective, Claire? I don't know if you want to comment about mentorship because I don't know much about that, actually, I have to say.
Yeah, so for me personally, I think it's a little different. Also, my background, I was an emergency nurse for 10 years. And one thing I would say there is it's definitely more mentorship in the healthcare field. But I'm actually loving this conversation. It's so refreshing. What I like as well is that everybody's kind of saying it doesn't actually matter if you're male or female. It's just what are your capabilities. So I think that's brilliant. But coming back to business mentorship, I've been lucky to have men that are brilliant at, saying, right, if you want to be here, this is what you need to do. Lowell was one of them. He was like, what are you doing? I met him in Kuwait. It was brilliant. And he's like, so you're doing this and this, but you don't have any academic business. You know what you need to do, an MBA. So I was like, oh, all right. So if it wasn't for Lowell and him talking me through it, and you know what I like about Lowell, I'm giving him a little plug here, is that he will ask you spicy, peppery questions. He won't just be like, good job, you're doing really well. And I think in a mentor, something that's good is when they ask you something challenging to see, are you critically thinking? Are you really thinking about plan A, plan B, plan C? So I think as coming from being a mentee, I think definitely that's the ideal, someone that you just ruffles you a little bit sometimes. I think it also builds a little character as well. So I really appreciate that. But in the business world, I've been lucky, like a lot of you ladies and the ladies that have paved the path before me, to it hasn't been a thing that I've been a female, but I think it's also owning who you are and going in and saying, well, this is me. The only way I'm going to get anywhere is I can't be this person or this person, and not saying, oh, I'm a female from here and doing this. And I think if you just go in, of course, not everyone's going to like you, but that's normal. That's all right. But just being yourself. And you're right, Kathleen, just having the right people around you, mentors. But I think in medicine, it's a lot more distinguished from the business world. But I don't know if Kat and Susan, you'd like to comment from a business perspective.
I think at least in business, we speak a lot about the difference between mentorship and sponsorship. I think that's true everywhere. Mentors are people that can give you advice. Sponsors are folks that advocate for you when you're not in the room. And I think mentorship is incredibly important in terms of opening your aperture and asking the really good questions, but having those sponsors that will help push you forward in your career. I think identifying them, seeking them, enabling them to be those great advocates on your behalf is so important, and understanding the difference between the two. And they're both very important. I don't know, Susan, if you'd add anything to that.
I would totally agree with you. That's a good point about this, about the sponsorship. That there are people who took me on and, you know, got me to the next place. A lot of times you don't even realize, you say a door opened for me, but probably there was somebody else that was maybe behind that door that at the time you didn't think about. So you have to be very appreciative. And I'm looking at this, I'm looking at this group of women, and I'm looking at Paola, who came to the United States and now is back. And so she's had like two totally different experiences in that. And I've been trying to put myself in when I first heard your story, I was trying to put myself in your place. That is probably one thing that I never had the opportunity to move to another country and do things there. And I think others on this panel have. And I think it's an extraordinarily cool move to make for a woman to be able to do that.
Yes, it is really rewarding. So the experience in the United States for me was amazing. And I had great mentors, and I'm very grateful about that. And I'm still in contact with them, and I believe in giving back. So I was sharing my experience around in Latin America as well. And this is something that I learned from good mentors. And so sharing your experience and helping others to develop their skills make also feel you good, and also, you know, it's good to see these results in or create a good environment as well. And also I had amazing activities in Central America, but with the University of Wisconsin, and humanitarian activities. These humanitarian activities gave me a lot of opportunities, gave me experience, and also I found myself in a leadership position in there. And this was also a challenge and very interesting. And I think that volunteer activities are also a good way to find contacts and, you know, and other females or males working in the same field of you, and to create or expand your network. So I think that moving around, going to another country always is something rewarding and gives you a lot of experience. And then when you go back, also you know, makes you feel good and happy with what you are doing. So I encourage people to go and move as well.
So I will just add on to the conversation about mentorship, because people often ask me, how do I find mentors? Or I don't have a mentor, or women don't have as many mentors. And you know, what I tell people is just ask. I love it when younger women my age, come to me and say, you know, would you mentor me? It can be for a short period of time. It can be, you know, for a longer period of time. And you all, as those of us, again, Susan, I'm sorry, you know, those of us that are older, that, you know, we've had lots of mentors. Some have stayed, you know, for 20 years, 30 years, but some come and go depending on where you are in your career, or what you need a mentor for. If it's for, you know, research, if it's for clinical practice, it's for how to raise a kid. Having a mentor who will listen to you. You're not going to be like them, but they're going to help you, you know, someone to bounce their ideas off of. For, you know, my mentees want to know that it's okay. What their plan is okay, or how do they choose between plan A and plan B? I'm not going to pick it for them. And so you don't want mentors that are going to tell you what to do, but they're going to lead you to think it through and be authentic to yourself. So I love that. And I encourage everyone to, reach out to any of us. Happy to either help find mentors, give advice, and as was said, sponsors. We all need sponsors who will open that door for us. Not someone who's going to be a long-term mentor, but someone you can say, I really want to be on that committee, or I really want to participate. How can I do that? Or am I right for that? Or do I need to go get an MBA, like Claire, to make, the next step? So I think that's all my comments on that.
I would add, I love the word sponsorship. I've never heard it used that way, Kat. So I'm glad you pointed that out. And as I was listening to you talk, I was thinking, mentorship and sponsorship doesn't end when you're a resident or when you're a fellow. It goes well into, even today, like, I getting back to Lowell, I think of him as being that little sponsor on my shoulder that has helped me, that has given me so many opportunities, and again, that goes on. And if I look back at my life and those people that really helped me along the way, they were many times people that you wouldn't have expected. And it's really, you feel almost more indebted because they didn't have to do what they did. And yeah, Ruth, I agree with you as well. I think that asking, reaching out, we're all busy, right? So if somebody reaches out to me and they want to ask me a question, then, I'm very open, and I love to talk to people. And I may not have the answers, but I can certainly tell you what my experience was, and, you take it or leave it. But those are the things that, to me, listening to the people that, as I went through this process of where I am today, and even in the future, I know there are people out there I could call. I can pick up Ruth tomorrow on the phone and say, hey, what do you think about something, and Lowell. And so those are important people in your lives. And I think any of us on this panel would be happy to do that for the next person.
Couldn't agree more, Kathleen. And I have to join the Lowell Kabnick fan club. Lowell has done a lot in terms of getting me involved with AVF, and just cannot thank him enough. I think the other thing sometimes that mentors can be so helpful with is to help you not feel like you're crazy. I think we all kind of carry all of this self-doubt sometimes. And sorry, my kids are in the background. It's just part of the, new normal. But I think about, I think we all carry some self-doubt, and to have the mentor say, I've had all those same feelings, and to see people that have been successful and acknowledge that they also maybe get nervous before a big presentation, or, or whatever the struggle is that a person's having, I think can be really powerful.
One other comment about that is that sometimes when we're walking through our life and going through steps, we don't realize sometimes when we should be taking the next big step. And sometimes that sponsor or mentor is right there. I know that when, for example, when I was at Albany Medical Center, and I was, first, the assistant and then the associate professor, it was somebody that was not one of my partners, but it was somebody else. It was Vivian Gatton, who picked up the phone, called me and said, girl, you're not ready for full professor. I was like, well, I was like, where did that come from? She goes, but I'm going to sit with you and we're going to figure out why you're not ready yet. But when you're ready, I'll write your letter. And literally it just, it wasn't that I reached out to her, she reached out to me. And the following year I became full professor, and she gave me opportunities that I didn't even think to ask for, because I didn't know that I could. So mentorship and sponsorship is important for us, not only in being there when we have a question, but sometimes they'll see something that we don't see in ourselves.
That was great. That was great. Great conversation. I'm going to switch directions just a bit, and I want to talk about how you amazing women balance different things in your life. And I realize that balance, and I always say it's an Oprah Winfrey 1990s word, because does balance really exist? No, because we all do 150% all the time. And every day you have to juggle your priorities. And some, childcare was probably more yesterday, but with the child going back to Michigan today, Kathleen, it's probably going down. So, and you've got grants due, Sarah, or you've got research projects due. So the balance has to shift. Chiara, I'm going to ask you, because you had a child just a couple years ago, and then pandemic, and you're trying to raise the child and deal with the pandemic and all the issues that happened in Italy this past year, multiple lockdowns, but still running a practice and keeping your family safe. So Chiara, why don't we start with you, and how do you prioritize and manage everything that you do?
So balance is not ever easy every day. There are some days that that we'll go out very early in the morning and you will come back very late in the night. So you will have not so many time to dedicate it to your family. You need to be organized. You need to be a lot of help from husband. My husband helped me really a lot and collaborated with me in a really a lot of role in the house, in the family. And you need help from nanny, babysitter, and housekeeper. And of course, you need a plan B every day, because sometimes they can do wrong or not as you have planned. Okay. But I think that became a mom was something adjuncted to my challenging every day, because now I learned that I can do a lot of things that I thought I had to do. So, and of course, you have a lot of responsibility during the day, and sometimes you have to come back home. And when my son go to sleep and I'm very tired, I continue to work to my computer to complete research or other role that you have to do. So I think is a balance that you have to reach every day. Just organized and think that you have time to dedicate it for everything. Maybe tomorrow you will have more time to dedicate it to your family or to your work. I don't think there is an exactly receipt to be balanced. Everybody have to find his balance, her balance.
Thank you. Anyone else want to comment, whether you have children or not? Kathleen.
Forgive yourself. Life is not perfect. You're never going to be perfect at everything all the time. It's okay. And the second thing, I totally echo what was just said about help. It takes a village. I had nannies, drivers, all that stuff, and that was the only way that I could get through. And if I took my computer right now and flipped the screen so you could see, my house is a mess, but I'm okay with it right now. So, you just have to let it go.
But there are some moments that you think I'm not a good mom. Okay, I know you think that, but I think it's normal.
Yeah, I think I think that my daughter says all the time, she's not interested in medicine at all. But I realized that I must have done something right when she turned around and said, "Mom, you're really cool." So I guess as long as she thinks I'm cool, I'm good. I did okay.
So let me just ask folks, balance is always been an interesting question and comment. But one thing that has happened, as we all know, over the past 15 months, is that the boundaries between work and home became blurred with so much working from home. And, the data has shown, and articles have said that people have worked longer hours through the course of the pandemic, because you have to get the same amount of work done. If I've got a load of laundry, or, you're teaching your kids, or having to, do something with your kid, or, right now I'm at my mother's house taking care of her. How, Kat mentioned the new normal. How are we going to, or do we need to redefine balance, priorities, organization in the new normal? I don't know, because I don't think we're going back to complete pre-pandemic, way of living.
I think, at least for me, I'd be curious if others felt this too. One of the hardest things about the pandemic, and just to build on what Kathleen was saying, is that I didn't have all the help that I would normally have. We, stopped having our nanny come because we were trying to be, very insular, bubble wise, and some of those things really were more of a challenge. But I think, how do we take advantage of this being able to work remote? Can I take my kids to the bus stop in the morning, and maybe, just block off half an hour in my day to do that, and have time with them I wouldn't have otherwise had? And is there an opportunity, I think about, all of you that present on podium all of the time, to do this is so much more reasonable than having to travel all over. And does that open up maybe more opportunities, especially for, physicians who are balancing kids, especially young kids, and their career? Could this be a whole new way to reach and build your personal brand, versus always having to be on the road? I'd love your thoughts on that.
I think that is a great comment, because I think that, having webinars like this is one thing that I have learned is incredibly efficient. We used to maybe pick up the phone or send emails. Now just having a Zoom call with folks, I never did an iPhone, so I never did FaceTime, but now just having a Zoom call is so easy. I mean, look at this. We're having an international webinar. This is international. So those of you that are thinking about professorship, this is international. So I think it will change how we connect and interact. I know that my priorities have changed. I don't want to be on the road. I don't want to be traveling. I do miss the networking, but will I go to 6 meetings or congresses in a year again? Probably not. Probably not. It's a lot of time, and I've realized I do want that time back. I do miss seeing my ladies, though. I miss seeing all of you all.
I agree, Ruth.
I think it's really true. I think there's an element of networking, and I'd be interested to hear what you think as to how well you can network, or sort of what kind of opportunities you can get in a virtual environment as opposed to face-to-face. And everybody always says, you don't network on the podium, you network afterwards. And that's where I certainly have had some of the most interesting conversations around research projects, and critiquing of things that I've presented, and would you consider doing that, and have you thought about doing X, Y, and Z? That really, I thought, hang on, actually that would be really interesting and good to do. And also setting up collaborations to say, well, shall we do this project together? And my only worry is that in a virtual environment, that's less likely to happen because you haven't got a room where you can just chat amongst, yourselves in a way. You sort of log in, present, log out. Of course, you will meet people, you will see them present, and you'll go, actually, they said something really interesting. I'll reach out to them, and that might work really well. But you might lose the fine nuances of networking. But I agree. 6, 8 international presentations a year is a lot of time, and certainly for me, it can't all come out of my study leave because there's not enough of it. So it all comes out of annual leave then, which, and yeah, it's, I think it's a fine balance, but I agree. It's a lot easier to be able to just log in and, converse with everybody now for something that had it been in the US, for example, I'd have to take a week off to go to. But I'd be interesting to hear your thoughts about networking and how that might work.
I think that's hard. One of the things I've missed about being in the office, and once I was cleared to go back to my academic office at the medical school, I went because I needed to have boundaries on my day. I needed to get in my car, go to office, and then come home because I found myself doing too much. What I miss, and what we will miss, and what you allude to, Sarah, is the spontaneity, the serendipity, we call them in the United States the water cooler conversations. You meet somebody, and you're just chatting in the hallway, and then, oh, that's a great idea, or would you be interested in this? You can't really do that in this environment. So I think, but what we can do is once we make those connections or build those collaborations, we can continue it past that. But I think it is going to be hard, but I think it's also going to be part of our new normal. And that I'd love to hear from other folks, because that one I do not have a great answer to.
I think
Susan,
one of the things that we, I keep putting myself on mute because I'm not on mute. One of the things that we have started doing, and you can't really do it with, people, from that probably aren't with the company, but I get so, I do get tired of, do get tired of looking at my screen, but if I do have an idea, we have teams at work and there's a chat. And so we can do this. And instead of picking up my phone, I don't think my phone just sits in the charger most of the day, because when I talk to people, I talk to them through Teams, and we do see face to face, and that has helped. That is not the way we did it. That's not the way we did it at the very beginning. And I would say that, the last 3 or 4 months, and if you just call somebody through the system, and if they're not there, they call you back, and you have like a 5-minute, 3-minute impromptu thing. Because I think the thing that gets to every one of us is you look at your calendar and every single hour is filled with another conference call or webinar or something like that. And I feel like, and like everybody did, days turned into nights, weeks turned into weekends, there was no difference. I would tell my husband, he'd say, "You did this again on Saturday?" I said, "Well, in normal times I would have been in Las Vegas or New York or Florida for this, be out of town for three or 4 days. So now I'm not." So then he kind of gets quiet. But I do feel like that is exactly what we all miss, is the human interaction, and that's about as close as we can get. And most conference calls that we have a lot more people. And I think, this is probably the best thing that I've been on in quite a while, because it's a small group and everybody's interacting.
I think that's probably true. You get a lot more people being able to participate, especially people who have to juggle other things,
Yes.
Children cover and everything else. So this is, it is much more inclusive, isn't it? So that's definitely positive.
Mm-hmm. Well, I think we've learned how to be more efficient as well, and some things are just more efficient. But yes, I think we've all had Zoom fatigue. I wish I had bought Zoom stock. Then I might be able to retire. But it's opened up many things. But one thing about, Chiara talked about organization one, and Susan talked about back-to-back Zoom webinars. I mean, nobody builds in time. So I've actually started building in blocks of time. And so I just block it. I learned this from Dr. Julie Freshlage. Just put in time and put on your calendar TTT, time to think. Nobody needs to know what it stands for, but I block time. You know, the formal travel time that I needed to go from one meeting to another. Now I still block, and it may annoy some other people, but I got to have some time, you know, to get up, stretch your legs, move around, and recalibrate yourself for whatever is coming next. Love to hear. I'm sorry I interjected there.
Paola, yes, did you have a comment regarding this?
I completely agree. Ruth, I'm stealing that idea. TTT, I love it. Yeah, you really do need some, I think that we are busy at work. We're busy with our families. We're busy with all kinds of things. And sometimes we forget ourselves. And I think that that is a female quality. And that's something that I know I suffer from. And one of the things I think we need to remember that we're not going to function at our best if we don't take care of ourselves. And again, I suffer from that myself, and I realize that, and I'm working on it.
Probably means getting up a little earlier, Kathleen. That's what I found.
Yep, I agree. I get up at 5 in the morning. My next door neighbor comes over. We walk together. We fix all the world's problems in 30 minutes every day. And then suddenly the problems all hit at about 5:45 a.m. But yes, no, I think that those little things, you just have to carve out that kind of time, whether it's, on Ruth's calendar or however you do it, it is extremely important. And yeah, so that's what I do.
Well, because we also all have conference calls, right? And those are at night, or if you are in Italy, in Great Britain, they can be, late in the evening, or well, actually, if it were late in the evening for me, it'd be early in the morning for you. So it's adding extra hours, so these volunteer jobs that we get involved with other professional medical organizations, and those all take time. So I think that that is something to consider in protecting some of your time. I don't get up early anymore, Kathleen. I have learned to sleep a little bit later because that makes me a happier Ruth. So I love what you do, and get up and do some exercise. I have really not been able to do that one.
The only reason why I think I've been good about it is because I have a next door neighbor who is, I think she feels the same way as I do. She's a professor. And so she, bless her, she does not have to be up that early, but we go every morning. We take her dog comes along, and we talk about all kinds of things, blow off a lot of steam, and then come home and start our day. It helps. So whatever you do for yourself, you got to do a little something, even if it's for a half an hour a day, to keep your sanity.
I think that's really true, and actually that's probably part of your support network that comes in with everything else that enables you to then function, having that person with whom to vent for half an hour. And the first thing, I mean, I'd love to have that would make me feel a lot better, I think. I think it's really true, but I think it's a really important message, isn't it, that you have to balance and your job and your work and your family, and you have to look after everybody else. And we've talked about looking after other people, but the bottom line is that you can't look after anyone if you're not looking after yourself. So whether it's going for a run early in the morning to blow off some steam, having a chat with someone or doing something else. I think it's just really important to remember that, because burnout, and we probably don't have time to discuss all of that, is a major issue, isn't it? And there's a lot of sort of concern around that. And I hear that word a lot amongst the trainees and with our mentors about the concerns of people burning out and, really working themselves at all hours, especially now, as we've said, with Zoom meetings and things. I mean, I've certainly had international meetings, for no fault of anyone, scheduled at 11 p.m. midnight my time that I've had to make time for. So it's really difficult.
Well, so we are at a quarter after, so I think 75 minutes. So so we all have mental well-being, and we preserve what's left of your Saturday in Europe and what's remaining of our Saturday here in the United States. This was a pleasure. Dr. Ozsvath, Dr. Lomazzi, Dr. Ortiz, I'd like to thank you. Susan, Claire, Kat, Dr. Onida, thank you so much. This was a pleasure. It was a pleasure seeing you all. And I think we are ending on a great note. And thank you for participating. If you'd like to say something, Sarah.
Yeah, no, absolutely. Thanks. I echo sentiment. Thank you so much. I really enjoyed it, actually, and it's been an eye-opener for me. So I've learned some today, which is fantastic. And just if the technical support would like to share the screen is just for the next session, which will be on the 3rd of July at 11 a.m. AST. We'll be discussing superficial venous insufficiency and running through all the case presentations and just hearing what experts in the field of phlebology do with different challenging cases, which I think will be quite interesting. We'll have a bit of mix of people, so hopefully different points of view. But thank you, everyone, and hopefully see you next time.
All right. Have a great day.
Thank you.
Thank you very much. Nice to meet you.
Thank you.
Bye.